Instagram and Facebook at the same time. Just making sure these are both working here before we get started. Today we're going to be talking about how to avoid belly strain during pregnancy. Okay, all right, we're all ready to go. So today we'll talk about how to avoid belly strain during pregnancy. So as your tummy grows during pregnancy, the abdominals get stretched out, and especially in that third trimester, they're functioning a lot differently than they do in your pre-pregnancy day-to-day. So they get both elongated but also stretched this way. So we want to take good care of this area to make sure that we're protecting it. So things that you want to look out for are that we're trying to avoid any of that coning, tenting, or bulging in the middle of the tummy. So this might look like a small bulge just at the top or just at the bottom or around your belly button, or it might look like your whole tummy just comes to kind of a peak in the middle. So that is what we don't want to see. So I'm going to show you how to change some of your movements so that you're not seeing that as much. Let's talk about what is diastasis. So diastasis just means separation. So that is when there's a separation of the abdominals. And in every person during third trimester, this is a normal thing to have. The belly just has to stretch to make room for the baby. But then in about a third of people after pregnancy, that separation doesn't go all the way back to pre-pregnancy. And so there's just some stretched out space between the abdominals. So if you know that you have a diastasis, these are things to do to continue protecting that area. And if you don't have a diastasis, all of these strategies will help you decrease the kind of strain that can contribute to a diastasis. All right, so the first thing that you're going to want to work on is that when you get up out of like a deep couch, what you would do normally before pregnancy is just kind of lean forward, use those abs to kind of crunch up and get up out of the couch. But what you're going to do during pregnancy, since those muscles aren't working quite the same, is you're going to use your arms and do a big exhale as you help yourself get up. So that is number one. That's going to help decrease the strain on your tummy when you get up from sitting. And then along those same lines, you're going to change the way that you get up out of bed. And so in first trimester, you might not need to do this, and you can kind of determine based on if you're seeing any of that coning or tenting. So in the beginning, when belly is small, you might be able to get out of a chair normally and get out of bed normally without seeing any bulging, tenting, that's fine. It's more later on in third trimester or at any point when you start noticing that tenting that you want to modify your activities. So this is going to be our bed. So normally, you don't have to think much about how you're getting up out of bed, but then during pregnancy, when your belly gets bigger, we decrease the strain on the tummy by doing a log roll. So you might have done this before, rolling to the side, and then again, really using those arms to help yourself get up, swinging your legs off the edge of the bed. It's going to way decrease the amount that we need to lift ourselves up like a big sit-up when you get up out of bed. All right. The second, number two, is to exhale with effort. So especially if you have other kiddos that you're picking up or with lifting groceries, any sort of effortful movement, especially lifting, what you're going to do is you're going to breathe throughout that movement. So we want to avoid any type of breath holding, because that breath in and then straining is going to put pressure on the tummy in a way that we don't want it. So instead, the way you're going to do that movement of lifting is you're going to inhale as you lower, and in the moment when you would normally maybe hold your breath, you're going to exhale with effort as you lift. So we say that term here over and over, exhale with effort. So that can apply to any movement, but especially with lifting. So inhale as you lower, exhale as you lift, and that's going to decrease the air that's able to push out on the front of your tummy. Okay, Number 3 is changing your posture. So you are going to help your tummy muscles be in the best alignment that they can as baby grows. So early on, when you can stand more upright and your baby isn't pushing you back, you're going to shoot for this lean into the wind posture where you're almost like a ski jumper with weight distributed throughout your foot instead of all in your heel. That's going to keep the front of your tummy in good alignment instead of letting it be extra stretched out. Now, as baby grows, it gets harder and harder to do this. So what you're going to shoot for is more of meeting in the middle. So this might not be achievable, but what you'll want to do all the time in third trimester, especially at the end, is really stand back like this. And so we want to stand more in the middle, letting your shoulders come forward over your hips so that things are more stacked and the front of your tummy is less stretched out. So those are 3 things to start with. Let us know in the comments if you have any questions. Thank you.